Hello, my name is Charita Roque. My project is entitled Postpartum Contraceptive Choices of Paris Teens. My mentor for this project is Dr. Kavita Arora. This project was partially funded by the Clinical and Translational Science Collaborative of Cleveland, which receives funding from the NIH. This presentation is solely the responsibility of the authors and does not necessarily represent the official views of the NIH. One of the reasons this project interested me is the trend in U.S. teen pregnancy rates. Overall, teen pregnancy rates have declined by over 50% over the last 20 years. However, the United States still has one of the highest teen pregnancy rates in the developed world, with 42% of teens reporting being sexually active. There are also over 600,000 American adolescents who become pregnant each year. In addition, 35% of teens can expect to experience another pregnancy within 2 years of an abortion or delivery. The decline in teen pregnancy rates has largely been attributed to the increased contraceptive use. However, teens are more likely to choose less reliable methods of contraception. That said, per the CDC, LARC use has been increasing in the general population from 2.4% in 2002 to 8.5% in 2009, and from 2005 to 2013, LARC use increased among teens seeking a birth control method from less than 1% to 7%. The objective of this project was to better understand decision-making surrounding contraception for postpartum teens. This is a qualitative study conducted via semi-structured interviews with teens between the ages of 13 and 19 following delivery on the postpartum unit. The interview guide was modeled from previous studies on teen contraceptive decision-making. A total of 12 interviews were conducted, and here you can see the demographic makeup of the participants. The majority of the participants identified as Black, 7 participants, 3 as Hispanic, and 2 as white. 4 of the participants had had a prior delivery. Here's a schematic representing our findings. Teens were strongly influenced by their mothers, as demonstrated via a thicker arrow, but also siblings, friends, and their prior contraceptive experiences. These influences were seen in their contraceptive choices prior to and during their most recent pregnancy. They were also influenced by medical providers both before and during their most recent pregnancy. Partners had very little input in their birth control choices. Their final plan was also affected by their own autonomy or self-determination and change in contraceptive goals, for example, a desire to delay future childbearing. One of the themes we noted was the influence of personal relationships. One of the interviewees remarked on the role of her friends, saying, "I was young, and a lot of my friends kind of influenced. They were in the shot, and they were like, 'Oh, I don't have a period. I can run around and do cartwheels all day.' So it just seemed like an easier thing. I wasn't even thinking about sex or consequences of birth control. I was just thinking, ooh, I want it." There are also many misconceptions about the risks and benefits of contraceptive methods, as well as misinformation about how certain birth control methods worked. One interviewee stated, "I think when I got pregnant, I was just being a little bit more risky, because I'm like, well, my period, it came back, and I don't know. For a while, that made me think I couldn't get pregnant, because I would have unprotected sex sometimes and not be scared that I was pregnant. I was like, I'm pretty sure the depot is still in me, even though my period is here. But it wasn't. It was a year, and that's when I realized it was a year without me taking it, and that's when I thought I was pregnant." Prior to the index pregnancy, many teens reported their mothers as a deciding factor in their birth control method. However, in the immediate postpartum period, they were less likely to rely as heavily on their mother's birth control recommendations. One teen noted, "She didn't want us to get on the pill. She wanted us to get the shot because she knew she was going to take us to our doctor's appointment every 30 days. Along with this transition away from their mother's contraceptive desires, teens were also more likely to choose LARC methods. This change was especially seen among teens This change was especially seen among previously nulliparous and multiparous teens. Teens who had experienced more than one delivery were more likely to elect a LARC method for postpartum contraception. None of the participants reported using a LARC method prior to their most recent pregnancy. However, 7 participants intended to use a LARC as their contraceptive method of choice. Of those, 5 were teens who had previously had a delivery. Overall, we found pregnancy to be a transitional time when teens begin to feel more empowered to have a greater voice in their contraceptive decision-making, with trends towards teens electing for more reliable methods of contraception.